Hello, I'm Dr. Daryl Rich of Core Chiropractic in downtown Roanoke. Have you been told your hip flexors are too tight, or have ever thought that your back pain was due to sitting too much? Do you stretch and stretch, but the progress is just slow and it doesn't happen at all? It's been said that hip flexors contribute to over 90% of low back pain cases and are perhaps the single most effective muscle that you should be stretching. However, sometimes stretching a tight area is not always the answer. Sometimes we need to be able to differentiate between what's a mobility restriction, like a tight muscle, what muscles need to be strengthened, or is it perhaps a motor control issue, a poor coordination? So we're going to cover that here in this video about what kind of muscles or what kind of exercise or activities we need to do to help fix your hip flexors. But first, the hip flexors is a group of muscles around the anterior side of the hip. They're muscles including the psoas, the pectineus, the sartorius, and the rectus femoris. The psoas and the rectus femoris are the ones that we're going to really work on in this video today because they're the two main ones that create most of the hip, back, and even knee problems. You see, the psoas is one of those that actually connects all 5 vertebrae of the spine, including the disc, coming out of there, crossing the pelvis and the hip, and attaching to the lesser trochanter on the femur. Anytime that you're sitting, anytime that you're bending forward, this muscle is really engaged. It's because of this unique position of not only be able to flex the hip, but also be able to flex the spine, that the psoas becomes involved in so many low back pain cases. Again, cases like bending forward or trying to lift something improperly, prolonged sitting, all of those have a root cause of the psoas being chronically stiff and tight or even spasming on us. Now, the rectus femoris is this muscle here that attaches on the ASIS of the hip and comes down and crosses the knee, and it's responsible for not only a lot of knee and or a lot of hip and back issues, but particularly a lot of knee cases are involved with this muscle. And particularly things like patellar tendonitis. That's the one that's most notably known for. So these muscles, again, are chronically tight and fibrotic with patients who adopt behaviors of repetitive flexion of the hip or repetitive flexion of the spine. Patients who sit several hours during the day, they sleep in the fetal position at night, maybe they drive for certain hours, are all creating flexion of the hip. And likewise, those who maybe stand at a counter, they work in the garden, they perform manual labor, they're repeatedly picking up small children or performing sit-ups during the workout, they're creating flexion of the spine. And these activities all help to contribute to this hip flexor tightness and eventually low back pain. In general, most of us know how to stretch our hips. Stretching is great and can provide some short-term relief. But we need to make sure that we always stretch with some type of follow-up of a resistance exercise or a controlled drill, something that's going to help make those lasting changes in that hip length. And we're going to show you some of those in this video that's about to follow, some of our best exercises for hip stretching and for mobilization of the hip flexor muscles. Again, these are important for lengthening the hip flexors and helping to retrain the antagonist muscles. So use this routine before any workout, like a run or a weightlifting session. Do it well before those. You can do it after a long car ride. You can do it after sitting for an hour or two, or again, maybe just part of your morning or evening routine. It's really helpful. If for those of you who have continual struggle with hip flexor tightness and chronic low back pain, you might find that active release treatment could actually be really helpful. Active release technique is a treatment that we use in our office. It's very strong, it's very powerful, and it works to help to unlock the chronic fibrotic nature that these muscles can obviously have when we've been doing some of these repetitive motions for such a long time. And when you combine that with this hip flexor routine, it's very, very helpful for reducing that chronic low back and chronic hip pain. If you want to learn more about ART and how it works, feel free to go to our website at coreroanoke.com. And we have some more information there on it. We also have a video that's there. And we, of course, invite you to leave some comments at the end of this video on our YouTube page. Or if you have any questions about some of the exercises that we're going to show you here in a second, feel free to contact us, either via email or phone, and we'd be glad to answer those questions specifically for you. I hope you enjoy these exercises. Give them a try every day. They are really, really helpful for you. Take care.